My name is Dr. Lester Hartman. I am from Westwood-Mansfield Pediatrics, and anything discussed today is strictly for the patients of Westwood-Mansfield Pediatrics. Your pediatrician may have a different opinion about what we are about to talk about today and use their advice. And what we're going to talk about today is the swimmer's ear, a common thing that occurs in the summertime. But first, before you figure out what a swimmer's ear is, we need to show you the anatomy of the ear. Now, if you look here right now at this is the ear, and it's a cross-section here of someone facing you, and it's a cross-section of what the ear actually looks like. And the ear actually itself has three rooms. The outer room, which is the portion where the hole in your ear comes in, lined by skin, which is like skin on the outside of your ear. Then there's the middle ear, which young children get the ear infections in, particularly in the winter, right here, behind the eardrum. And the eardrum is a wall there that prevents any fluid from passing through at all. No fluid can pass through. And then there's the inner ear here, the third room, where the nerves are for hearing and for balance as well. So what we're going to focus on is this area today, because this is the area that can be infected by somebody with a scratch, with their fingernail scratching inside the ear, a Q-tip, or people who have really dry skin in here that gets cracks, and the bacteria from the swimming pool, particularly a bacteria called Pseudomonas, can settle in here and cause swelling and inflammation and be pretty painful. Typically, swimmer's ears, as I said, occur in the summer because it's from pool water, lake water. Rarely seawater will cause that, because salt water does not seem to create the issues bacterially that your lake and ponds and pools do. It's important to tell the physician where you've been swimming too, because that can affect your treatment somewhat. So, what happens is as the area in the ear that I showed you before gets inflamed, if you move your ear here, it hurts to move the ear. Where it hurts the most isn't just moving the ear here, but pressing right here. Like this port called the tragus is, when you press down, it's like closing a garbage can lid, and that can really hurt. And that's the first thing that really hurts in a swimmer's ear. Now, kids sometimes can't sleep on that ear, whereas the middle ear infections, I showed you this room, it's not going to bother them to sleep on an ear. It's not going to bother them to move the ear as well, because that portion is not communicating with the skin on the outer ear. Therefore, it's not going to hurt when you move the ear. So what happens is then the first sign of this is that when you move the ear, it hurts. Then what will start happening if it becomes a deeper infection is that it'll spread into this area here, the area where there's some internal cartilage. And those kids have a moderate swimmer's ear, and they may start not wanting to open their mouth much because it hurts to open their mouth too much, because the cartilage here is inflamed and it's leaning against the jawbone right here. So then when things get worse and worse and worse, people will not even open their mouth, and there'll be swelling in the ear. That's very rarely happens. And in our office, most people are calling when the ear starts to hurt when you move it. And very rarely does it get into these other problems. So, when you call our office, and if you say, you know, it hurts to move the ear, like that, it's the summertime, your child has been swimming, it's very important to notice that we can treat you without you coming into the office over the phone with antibiotic drops. And typically what you do with the drops, and this is very, very important, because the most important thing is getting the drops into the ear. More important than any oral medicine will be in the treatment of a swimmer's ear. You tilt your head back, the child's head back, pull the ear a little bit, and it will hurt. You put the drops in, as many as the clinician has ordered for you to do. You take that trash can lid, the tragus, as I told you, and you push it down, and it will hurt. But that drives the medicine in the ear. Then you can take a little wick of cotton and stick it in to keep the medicine right in the ear and not roll out of the ear. Usually this is 2 to 3 times a day for a 5 to 7 day period. Most kids, we say, avoid dunking your head in the water for 48 hours with this. Now, there are a subset of kids, okay, that will have recurrent swimmer's ear, and every year they'll have some swimmer's ears. And the best thing to prevent swimmer's ears is to use a mixture of regular rubbing alcohol with white vinegar mixed 1 to 1. So in other words, a teaspoon of white vinegar with a teaspoon of rubbing alcohol mixed together. Take an eyedropper, and in the morning, every morning and night during the summer, and a lot of kids swim every day in the summer, you put that mixture in each ear, like 5 drops in each ear, twice a day, morning and night. Now, one caveat to this is if somebody has tubes in their ears, you never use vinegar and alcohol because it will sting and be extremely painful. So those kids you need to be very careful with it. Now, children that develop in spike fevers, they can't open their mouth, those are the ones who are having difficulty opening their mouth. Those are the ones that need to be seen in the office as soon as possible. Now, that's few and far between, but it's important to have them come in because sometimes they need oral antibiotics, sometimes they need to see an ear, nose, and throat doctor, and they still have to continue with the topical antibiotics as well. So, this ends the conclusion about what a swimmer's ear and how to manage it as well. So, have a good summer this summer and every summer after this. This is Westwood-Mansfield Pediatrics, proactive in your child's care, empowering families for over 50 years. And remember, if you have questions, call us, but also we can treat your child and save you a visit and a copay to the office as well, if things seem to the nurse to be reasonable. Thank you and have a nice day.